So here's your parasternal long axis, right? There's an arrow. We're not sure yet though if this is a rib shadow or a ventricular septal defect, so we're gonna wait to see other views. So look at the short axis. You see this arrow here? An arrow in the left atrium below the aortic valve, in the bottom of the left atrium, right? So think about what it's pointing to. There's red flow going into the left atrium from the bottom. Here's your parasternal RV inflow view. There's an arrow, and it looks like there's a big dropout in the atrial septum. You see that? You see the arrow? Okay. So let's look at the color coming up. And now we can see flow through this dropout. So what do you think this flow is?
It's a
It's a shunt.
septum.
It's a shunt, right? So here we also see it in an apical view. Do you see the arrow? Right? So we're gonna see this again, and I'll ask you the questions. So we suspect that if this patient has a heart murmur since birth, it's gonna be either some kind of valve disease or a defect, right? So on this parasternal long axis view, it's not conclusive that this arrow is pointing to a defect because it could be a rib shadow, right? So the first question is going to be on the short axis. Everything else looks okay except the RV looks a little big. Do you agree?
Yes.
Okay. So now, what does the arrow point to here in this short axis view? Pulmonary what?
Veins.
Vein. That's a pulmonary vein. You see here how the flow is coming back from the lungs? Usually when we have a shunt, left to right, there's more flow to the lungs, right? And then it increases return to the pulmonary vein, so that's what we were seeing here. So that was a flow through the pulmonary vein. This arrow here in the RV inflow view points to which of the defects? What defect is that? Is it an ASD? Is it a VSD? Is this the SVC or is it the coronary sinus? What is this? An ASD, right? This is an atrial septal defect. What does the color flow Doppler show on this same view? Left to right shunt, right? Left to right shunt. And through this ASD, right? How about on the apical 4? What does the color flow show at the arrow? What are we seeing? No, it's a left to right shunt. If it's a PFO, it would be right to left. So if is this a PFO or an ASD? It's an ASD. Okay? All right.